Hydrocephalus is a condition characterized by an abnormal accumulation of cerebrospinal fluid, CSF, in the brain. This buildup of fluid can put pressure on the brain, leading to various symptoms and potential complications. In this guide, we will explore the causes, symptoms, and treatment options for hydrocephalus. What is hydrocephalus? Hydrocephalus occurs when there is an imbalance between the production and absorption of cerebrospinal fluid, CSF, in the brain. CSF is a clear, colorless fluid that surrounds the brain and spinal cord, providing cushioning and nourishment. It is produced in the ventricles, which are hollow cavities in the brain. In a healthy individual, CSF flows through the ventricles and is then absorbed into the bloodstream. However, in cases of hydrocephalus, this normal flow is disrupted, leading to an accumulation of fluid in the ventricles. This can cause the ventricles to expand and put pressure on the surrounding brain tissue. Types of hydrocephalus. There are different types of hydrocephalus, depending on the underlying cause and the location of the obstruction or disruption in CSF flow. The two main types are obstructive hydrocephalus. This type of hydrocephalus occurs when there is a physical blockage that prevents the normal flow of CSF. The blockage can be caused by various factors, such as a tumor, cyst, or congenital malformation. Communicating hydrocephalus. In this type of hydrocephalus, the flow of CSF is not obstructed, but there is an impaired absorption of the fluid into the bloodstream. This can be due to inflammation, infection, or other underlying conditions. Causes of hydrocephalus. Hydrocephalus can be classified into two categories based on the timing of onset. Congenital hydrocephalus. This refers to hydrocephalus that is present at birth. It can be caused by genetic factors or specific prenatal conditions that affect the development of the brain and CSF flow. Acquired hydrocephalus. This type of hydrocephalus develops after birth and can occur at any age. It can be caused by various factors, including head trauma, infections, tumors, or bleeding in the brain. Symptoms of hydrocephalus. The symptoms of hydrocephalus can vary depending on the age of onset and the severity of the condition. Common symptoms include headache, nausea, vomiting, cognitive impairment, balance and coordination issues. In infants, hydrocephalus can also present with symptoms such as an enlarged head size, bulging fontanelle, soft spot on the top of the head, and poor feeding. Diagnosis. Diagnosing hydrocephalus involves a combination of medical history evaluation, physical examination, and imaging tests. The doctor may perform a neurological examination to assess motor functions, reflexes, and balance. Imaging tests, such as an MRI or CT scan, can help visualize the ventricles and determine the extent of fluid accumulation. Treatment options. The treatment for hydrocephalus depends on the underlying cause, the severity of symptoms, and the age of the patient. The main goal of treatment is to relieve the pressure on the brain and restore normal CSF flow. The two primary treatment options are Surgical intervention. In cases of obstructive hydrocephalus, surgery may be necessary to remove the blockage and restore proper CSF flow. This can involve placing a shunt, a small tube, to drain the excess fluid from the brain to another part of the body where it can be absorbed. In some cases, endoscopic procedures may be used to address the underlying cause directly. Medication. In certain cases, medications may be prescribed to reduce CSF production or to manage symptoms such as headaches. However, medication alone is usually not sufficient as a long-term treatment for hydrocephalus. Conclusion. Hydrocephalus is a condition characterized by abnormal accumulation of cerebrospinal fluid in the brain. It can have various causes and present with a range of symptoms, including headaches, nausea, vomiting, cognitive impairment, and balance issues. Timely diagnosis and appropriate treatment are crucial in managing hydrocephalus and preventing potential complications. If you or a loved one experience any symptoms associated with hydrocephalus, it is important to seek medical attention for proper evaluation and treatment.